welcome back to the Neurodiverse Couples Coach's Corner. And I'm flying solo today without my sidekick, Barbara, but I'm Dr. Stephanie Holmes. And if you're listening for the first time, I am in a neurodiverse relationship. I have been a licensed professional counselor, and now I coach neurodiverse couples. And today I have as my guest, Candice Christiansen. Thank you for being with us today.
Thank you for having me.
So listeners, I want to remind you, we're doing a series, and we started off this series last week with Dr. Janice Cottle, and we talked about porn and sex addiction and when things become problematic and sometimes a legal issue. Today, Candice is going to walk us through some co-occurring or some issues that may occur in the autism community with porn or sex addiction and how you work in therapy. Then we'll move on to Just the Guys with Michael John Cusick, an interview with my husband and Michael Cusick, who is also he refers to himself as neurodivergent, and he talks about his story overcoming sexual addiction through surfing for God on the internet. Then we'll move to Dr. Andrew Bauman, and we'll talk about some difficult, destructive, and not helpful messages that the church and Christian community has added on a layer to this complex issue. So, Candice, thank you for being here today. And would you introduce yourself?
Sure. So I am autistic ADHD. I was diagnosed at 44. I'm now 51. I was misdiagnosed my whole life. I am a licensed clinician of 21 years in Utah. So I have my own Neuro-Inclusive healing center called Namaste Center for Healing. And we work primarily with autistic ADHD and other neurologically different adults and couples with a variety of intimacy issues. We are very well known nationally and internationally for our customized neuro-inclusive intensives that we do with neuro-different individuals and couples who are wanting to heal from betrayal, trauma, and violence.
All right. Well, thank you for all of that. And I've been listening to some of podcasts and workshops and things that you've done. And I felt it was really important to have someone who was neurodivergent or part of the community to speak into this. Sometimes when I've talked about some of maybe the co-occurring issues that could occur with the community and porn or sex issues, I get a lot of pushback. Now, specifically, some of my listeners are Christian men or religious men, and so there's that feature. But I really wanted to talk today compassionately, research-based on why might people in the neurodivergent or autism community or ADHD community maybe be more likely, or is that not even a thing? So let's kind of talk about porn use and sex addiction and co-occurring things. And I'll just kind of let you kind of talk me through it. I'm going to learn from you today.
Okay. Yeah, no, I think this is such a helpful conversation. So I really appreciate that we're having it. One of the things that I'll say, autistic people, many want to have a relationship and be intimate. And a lot of times there is a struggle in terms of that. For so many autistic men that I've worked with, and I've done this for quite some time, relationships are unscripted, just like the world. And so it can be very overwhelming being in a world where there's a lot of nuance, when part of the autism neuroculture is to be very direct in our understanding of what's going on around us. So the world is very unscripted, and relationships are very, very unscripted. There isn't just this book. I will be coming out with a workbook, hopefully by the end of this year, about this, but it can cause a lot of fear and anxiety for so many autistic individuals, and especially autistic men and young men who oftentimes, if we look at their history, growing up in childhood, many, if not all, have been bullied, not a lot of friendships, not a lot of dating experiences, and come online, and the online world is very ominous, but it gives the impression of safety, especially when there can be a transactional interaction. So, and then there's sex everywhere. We live in a pornified culture. So for an autistic young man, for instance, who's curious about sex, which of course, being a teenager, hormones, etc., why wouldn't you be? Getting online to learn about sex, relationships, intimacy, what do we see? We don't necessarily see the healthiest things. So curiosity and also safety, what I see with like every kind of profile of an autistic male that ends up with sex or porn addiction is it's transactional. So I pay you, you show me, or you do for me. Erotic massage, strip clubs, OnlyFans, and trigger warning for those that are listening, because I am talking about some things that might be activating. But where I pay you and you do this for me, there's this illusion of safety in it, Stephanie, because there's this idea of I don't have to be relational. We don't have to talk. I don't have to even look at you. There's no pressure to perform or fail in performance, if you will, by talking or trying to be, quote, intimate. It's I literally pay you, you do this for me. Or I look online, I can visually sensory seek and visually stimulate by looking at pornography and then tactile stim through masturbation. And it's very soothing to my system for an autistic person. Okay, now I'm just giving that example. I am not a porn or sex addict. So that's really what I see a lot of with the male identified clients that I work with. Now, with the female identified clients I work with that come in that are struggling with sex or pornography addiction, a little bit different. Not so much pornography, and I will see love addiction mixed in with all genders, but really seeking soothing and safety in other people. So can get into relationships that are very abusive, where it can look like compulsion, it can look like love addiction, but really seeking safety in unsafe people. And so that is often what I will see when I'm working with a female identified autistic person. So that's a lot. That's a mouthful. So I'll pause and take a drink because I just info dumped.
All right. No, that's all important stuff. I was just watching one of your workshops. I don't remember who you were doing it for, but I wrote down some things from a slide that you were talking about. So freedom from rejection, there's not commitment with porn or sex, no pressure, false safety, sensory, and low stress, less relational. But then you also talked about maybe behaviors like maybe the porn is what I'm using as a sleep aid. It helps me fall asleep, or it helps me stress, or it's a sensory stim. What I didn't hear you say, and what I think is really important to say, is that I didn't hear you say, well, because of the autism or your neurodifference, your partner is just going to have to deal with that. Like that's just who you are. And that's just part. I heard, let's talk about how that impacts the relationship and what are some other things, what are some other behaviors, what are other strategies. So can you talk a little bit more about that? So while this is co-occurring, I definitely didn't hear anything about a past or this is the way that it is. There are other things we can do. It sounds like you're seeking something else. Let's talk about that. So how would you be working with clients, or how would you take them into looking at that a little bit different?
I love that. I'm writing some stuff down. It helps me track. So yeah. And so this isn't something that I would ever say, like you said. I'm so glad we're not saying that, oh, this is just how an autistic person is and the partner needs to, no, that's not what it at all. There's two things that I talk about, three actually related to the autism triad that I'm going to weave in here because they relate and they're very core for autistic people, and why some will go towards coping in the way that they do through porn or sex. Sensory sensitivities is huge, and no one really talks about it enough. We are very sensory sensitive to our environment. It's very overwhelming oftentimes, but it can also be underwhelming. Too bright of lights, too loud of noises, too many people, textures, taste, touch, all the things in the environment. And second to that, the energy and emotion, what I call emotional contagion of other people, can be very overwhelming to our systems. It can be very confusing to our system. So oftentimes people will turn, if they are struggling with porn, for instance, to that as a way to soothe the emotional activation. I try and stay away from dysregulation because so many terms are pathologizing, but I feel anxious, I feel depressed. I look at this, it helps me feel calm. So it becomes like a medication, if you will. I feel anxious, I feel depressed, I feel lonely, I feel bored. I turn to this for soothing behavior. So the coping skill, instead of using porn, for instance, is that kind of medication, is really how do we regulate or teach you soothing of your own autonomic nervous system so that you're not viewing the world and your environment and everyone around you as a danger cue. Because autistic people are walking around in the world, I know from my own lived experience, and every autistic person, that's all I work with, that we have a low level of anxiety all the time. So we have a low grade level of feeling danger in our environment all the time. So for a lot of us, like sugar, I used to eat. That used to be my oral stim that would calm me down. And for those that have porn, they visually stim to calm them down. And some will add in masturbation as a tactile stim to soothe them from that anxiety, the depression, the loneliness, the boredom. And so we're teaching what is going on in your autonomic nervous system. How do you identify that? And how can you regulate that? Whether it's through breath, we use a lot of tools, EMDR. We do a lot of internal family systems, which is just connecting people, especially somatic work. We have breathwork practitioner. We have a yoga therapist on staff. All the things that we can do to teach people that you can actually be your own resource. So you're not having to go outward in order to feel that sense of calm and soothing. And it does take time. It definitely takes time, especially for someone who's autistic, who has resorted to looking at porn, say, for 10 years, 15 years, 20 years. It takes some time, but it is possible. It is actually possible. We've seen it work with a lot of people, just different tools. And some therapists use different things with clients, brain spotting, et cetera. But those are the tools. Sometimes medication is needed while people are working through a lot of trauma that so many autistic people experience in the world, because the world's traumatic and how we're treated oftentimes as traumatic based on our autism. So those are just some examples of different ways we would help. First, it's identifying, naming, and then what can we do with that? So teaching the tools and the skills for doing it differently, coping differently.
You said something that I want to track back to. You said that autistic people tend to live with a low level of anxiety, which, as I said to all of my clients that I work with, and I get a lot of pushback from autistic men that, no, I'm not anxious. I'm not anxious. I'm not experienced anxious. I'm not even a worry person. I'm logical. I'm analytical. I do not know what you're talking about with this low level of anxiety. And then several months into working, you'd be like, oh, I do have some anxiety. I wouldn't have called that anxiety. So what differences do you see in maybe men and women on the spectrum manifesting anxiety or feeling anxiety, more internal, more external? Mm-hmm. What are the things that you see with your clients?
Yeah, I mean, when there's autism doesn't look a certain way, so it definitely presents differently, especially in adults, because we've learned to mask and really kind of act like what's around us. So I want to name that. I also want to name that alexithymia is often very prevalent for folks that are autistic. So alexithymia is where we can feel what we're feeling, but it can feel very overwhelming. And so it's hard to name what we're feeling. And we might actually describe it like your client said, like, I don't feel anxiety, because maybe they've learned a coping skill in order to navigate or manage. Well, I just stay in my head, which feels very safe, because being in my body as autistic people, we feel very strongly, doesn't feel safe. So that makes sense that the autistic client would say, I'm just going to stay upstairs. I do believe that if we look at the research on autistic females and just my lived experience, and then working with the autistic females I work with, we've been socialized to be more connecting and to be more expressive. So you will hear a lot of autistic females say, I was called a drama queen. or my passion and my expression of emotion was labeled as dramatic or too much, right? Whereas an autistic male identified client might say, I internalize it. Like I struggle to identify, or it feels very overwhelming. And so I freeze. I might have a freeze response. Whereas an autistic female might identify as having a fight response, which that I don't want to like lock anyone in because we all literally present so differently. These are just some things I've heard. Other autistic females I work with and non-binary individuals that I work with, will do more of just crying. Like that might be viewed as like an expression, right? But not having the words to say because it's so overwhelming what they're feeling. So those are some examples, but I do want to, give that caveat that we really present very differently, no matter if I'm a female standing next to a female. Yes, we might speak passionately, just like our male counterpart or a non-binary counterpart, but we also might do it a little bit differently in our expression.
What can be some of the barriers or challenges for autistic individuals who maybe there's been a discovery or maybe there's been a job loss or a legal implication that's like, this has got to be looked at and dealt with? What might some of the barriers be to seeking help? Because you talk about, pervasive demand for autonomy before. So what could be the barriers to getting help and then staying with the help or kind of breaking this pattern? Because routine is sometimes a thing for autistic people, and maybe it got part of one's routine, like the sleep aid that the person had. So breaking a routine can also be very difficult. So when you talk about challenges of getting help and kind of breaking the cycle, breaking the routine.
Yes. So routines, schedules, and structures are foundational for autistic humans. They're not optional. Sometimes they're absolutely foundational for us to function in the world. When I don't have a routine or a schedule that I follow, I will aimlessly scroll on my phone for hours. And that truly is because I get so overwhelmed by not knowing where to start that structure is really helpful. Then we add on someone in recovery, and we know with recovery, routine, schedule, and structure is so important. So I want to say that. I want to say too that for so many autistic individuals, and I've heard this from ADHD folks as well, people come out of the mental health and medical world after seeking help with a lot of trauma by well-intended but highly uninformed therapists and medical providers that do not understand what autism looks like in adults, which looks varied, and therefore often will traumatize unintentionally the autistic person. So going in to seek help or to having the courage to do that again can be very challenging for an autistic person because of that. I've tried it, it doesn't work, or, I'm labeled or I'm judged or I'm told it's not autism, or this person's a doctor, and so they're telling me I just need to get in a relationship. I mean, I've heard all kinds of things, or because I give eye contact, I couldn't possibly be autistic. And so there's just a lot of distrust, I think, because of the trauma. I also think, again, based on a lot of autistic folks' experiences with that, starting with school, et cetera, and the labels put on and not fitting in, trying to figure it out, trying to fawning to fit in, which are all trauma responses, that it can be very, very challenging because of the labels. And again, trying to figure it out on our own and being judged as being different, that can be really scary and hard to seek help. And then just, I think, staying with it, if there isn't a connection and safety and trust built with a provider that really is neuroaffirmative and very supportive of the autistic client system, that can be why I think it's hard to remain in treatment. And then I will say there are clients that have, if I use the internal family systems model language that I love so much, parts of them that, it's like really struggle with maybe the regimen, if you will. It can get very overwhelmed with the regimen of treatment, or maybe don't understand what's being asked of them. That can also be overwhelming and hard to stick to. I will say, however, that I am like full with clients. I have clients that don't drop off of my schedule. And I do think, and perhaps you've seen this as well, being a clinician that's neuro affirming and sensitive, that once clients have the right therapist and the accurate treatment approach for their neurotype, they will stay. They will stay in treatment. They're on board and they're in. And that is with any diagnosis, I really believe.
I have a thought, and I don't mean to totally throw things off, but it's anecdotal information to me. And I'd love to know if you have a differing opinion or talk to other colleagues. For older adults, males getting diagnosed later in life, it seems to be a little bit more difficult than females. I mean, accepting it. For some of my female clients, it's like, oh, that explains that. And I've had 10 other diagnoses and I didn't really think any of them fit. And, from personality disorders to anxiety to, whatever. For my older men clients, when they get this label, I don't know if it's maybe demand for autonomy and don't want to label or don't want to be put in any kind of box. I find that the older guys tend to struggle with an autism identification more than females. I don't know if that's been your experience, or do you have any thoughts on that?
I have had the opposite. I've had, we just did an intensive with a gentleman who is he's older, and a lot of relief with it. There's a lot of relief. Yeah. And so I think, again, if that's happening, what I want to say with so much compassion to anyone listening that is struggling with that, first, you don't ever have to take on a label, because it doesn't, there's a way that we can support you and what you're wanting support with around that. Even if you say, well, I don't want to take the label of autism, right? I think there's so much stigma around autism that people feel more comfortable with a diagnosis of ADHD, even though so many of my ADHD diagnosed folks, no matter what their gender, actually are autistic as well. They're ADHD. But the stigma around what autism is and the misunderstanding around what autism is, I think a lot of times creates a lot of fear for older men. So I want to just say that compassionately, that it makes complete sense to me that you're experiencing that with older men that are saying like, oh no, that's okay. Yeah, you don't have to take the label on. And if we could support you in feeling less anxious and support you perhaps with communicating in a way with your partner that they can learn to communicate with your neuro language and you can learn to communicate with their neuro language and support one another. What are your thoughts on that? Would you like some support with that? I actually think that would probably break the barrier a little bit.
So you mentioned communication, and I'll segue us to the next section. So we kind of talked a little bit about why neurodivergent individuals might, struggle with sex addiction or porn use. So communication and intimacy are pretty important for a healthy sexual relationship, between two people. And communication can be a difference, or what I describe as connection could be different, or intimacy could be different. And so also bringing in rejection sensitivity dysphoria. So let's say a non-autistic spouse with an autistic spouse, and let's make the autistic spouse male and the non-autistic spouse female. And she's like, when I say, hey, I like it this way, or could you touch me this way, or not there, hey, could we try that? Just as kind of normal, hey, let's feel this out together. The autistic spouse taking that as criticism, feeling like rejection, and that being another struggle. So there might be the addictive piece, but now, okay, let's just say we're in recovery and it's going well. We're trying to find that healthy sexual piece. Communication and being able to say what I like and what I don't like between both people is pretty important. So will you bring that rejection sensitivity piece in?
Yeah, rejection sensitivity, we know, especially with ADHD, is a part of diagnostic criteria in Europe, I believe, but it's not part of the diagnostic criteria in the US, and it should be. It's a physiological trauma response to real or perceived rejection. So it causes a person that experiences rejection sensitivity, which so many autistic people can have, to physiologically feel traumatized when all it really is, and I'm not diminishing it because I experience it as well. what I'm doing is just really hopefully simplifying the definition to it's a difference in needs and it's a conflict in needs at times. That's it. And so the first thing really is if one of the things that my partner Chris and I have done that have been really helpful that we offer to other people is we're just having a conversation. You haven't done anything wrong. I'm just asking for something that I like, and I'd love to hear what you like as well. But sweetheart, I love you. And what I'm telling you is that I like something. I'm not saying that you didn't do something or you're doing it wrong. Just that reassurance oftentimes can be helpful. And then let's also define some terms, because the way that, I might view sex or foreplay or it might be different from the way you view it. And that's okay. Let's just define some terms the way we each understand them so that we have clarity around that, so that there isn't a misunderstanding. But with rejection sensitivity, oftentimes it does feel like I've done something wrong. And there needs to just be that reassurance that you haven't. Like it's okay for you to have requests. It's okay for me to have requests. And both doing it in a way that isn't activating or in like using, just if both people can be calm is really important. Is that hard? Yeah, it's really hard, especially if somebody is feeling very, very activated. And like I said, that the autonomic nervous system regulation is so key and crucial for an autistic person, because so much in our environment can cause us to feel very activated. So soothing, being soothed, being calm, being regulated is so important. So that these conversations can happen without it feeling so personal, because it's not a personal attack. It's a needs request. It's a needs request. And my neurotype has certain needs and your neurotype has certain needs. And then in sex in the bedroom and with intimacy and foreplay, those need to be defined, because one person may not even know what they are. So many autistic people don't even know what foreplay is or how to do it. And that's okay. Like spell it out for each other. Let's name it. In the workbook I'm writing, there's a lot of talk about sex. Sex will be in the title, and there's a lot of talk about sex with autism, because sex and autism often don't go hand in hand in our culture. Autistic people are assumed to be asexual or not want to be in relationship. Some people are asexual, but not all of us. Many of us want to be in intimate relationships and want to have sex and want to be sexual beings. And so working through that really is, like I just described, can we slow this down? Can there be some reassurance about what we're talking about? Do we need to be sitting in front of a neuroaffirmative therapist that can really look at the parts of you that get activated when we talk about this, so that we can have a productive conversation about my sexual needs and yours without it feeling like a personal attack, because it's not.
So one thing you said that's really important, well, you said many things that are important, but you said the asexual piece. So it's been assumed that, autism comes with asexuality. And sometimes that is the case. I would say where I see it in my Christian culture is maybe the autistic person thought, well, so let's just say they were dating. It's like, well, I didn't think that those things would come online until we got married. And so the boyfriend, girlfriend is like, oh, they were so respectful of me. They didn't touch me. They didn't try to do anything. They respected my boundaries, and they have a connection and they have chemistry together. And then they get married. And then sometimes the autistic spouse was like, holy moly, what is this? Maybe it's a sensory thing, or maybe, quote, it didn't come online like they thought marriage was somehow going to bring it online. And so in the culture I work with, since abstinence before marriage is part of the culture, one might not know until they're married. And that causes some partner communication needs, like, because one signed up for a sexual relationship and one honestly maybe thought they were going to provide that, but didn't know, because they're undiagnosed, that was even a problem. So will you tease out asexuality versus maybe sensory discomforts and maybe sensory barriers that might look like asexuality? How would you kind of talk about that with some of your clients?
Yeah, I mean, I want to say, and I'm just aware of the time, I'm probably going to have to get off early. I apologize. I had, as we spoke, the time that we kind of use on the time, and I haven't heard back from the client. So I just want to be aware of that. So perhaps I can come for a part two.
Yes.
I want to honor those folks that are listening that are truly asexual, that really feel like, sex is not for me. Can you have connection and intimacy in other ways through touch that is sensory soothing to you and your partner? So I want to acknowledge that. A lot of times, and I have a free ebook on autism and sensory sex that's on my website, namasteadvice.com. People can get it. And I will also talk about a lot of this in my workbook that will be coming out. I want to say that a lot of times, the sensory environment and not feeling emotionally safe and having a history of trauma will impact an autistic person's belief around their ability or desire around sex and having sex. So if there can be some identification of the sensory things, issues that are going on, and how can we feel emotionally safe? What does it mean to consent? Sex can be messy, and the taste, touch, the fluid, all the things can be very sensory overwhelming, that a lot of autistic people will say it's too messy. I don't want to do it. I'd rather cuddle. I'd rather snuggle. So can you do things around that so that there are possible ways to have a sexual experience, which don't just look like penile vaginal sex? There are a lot of different ways. Maybe you have to shower before or after. Maybe there's just certain things, certain smells, certain, lubricants, etc., that need to be in place in order for the person to feel comfortable sexually. And then working with a therapist, a trauma-informed therapist that understands their trauma, neuro-affirming, that can work with them on their trauma around sex, defining what consent means, defining what your emotional needs relationally are, so that you can try that on. That's what I would say, versus someone that says that this will never happen. Okay, if it never is going to happen, are there things that you're okay with me doing on my own? Sexually, masturbation, for instance. Are there ways that we can be connected in the room sexually, even if you don't want to be sexual, so that there is touch and there is warmth and there is intimacy if we are not going to do that? Because that can be really challenging. I have a lot of compassion around that.
I could have such a long discussion with you. We'll have to have you come back and do part 2 and just talk about sensory issues in sex, because that is a much requested. But thank you for being here today. Listeners, we remind you that there is hope for your future and you're not alone on your journey.